Hi, this is Vaibhav Vaidya with the Fits on the Go blog here at ACC 16 in Chicago. We are joined by Dr. Hugh Calkins, who is the director of EP at Johns Hopkins. Thank you for joining us today.
Well, thank you. It's great to be here.
Dr. Calkins, could you tell us a little bit more about your thoughts on duration of training for fellows in cardiac electrophysiology and the changes that have been made to that?
Yes, one of the, I think, interesting changes in the field of EP is that we've moved EP training to a full 2 years. Instead of 12 months for ABIM training, it's now 2 full years. And I have to admit, I was partially responsible for pushing this forward because it was something we recognized was a real problem, that some programs had a 1-year program, some had a 2-year program. Sometimes it was part of the first year was part of the 3 years of cardiology. And now we made a big effort, the ACC, HRS, the AHA, working with ABIM to make EP training 24 months. Now you could say this is abusive and it's too much and it's too long, but the EP field keeps getting broader. There's many procedures, a lot to learn. You really can't learn it in 12 months. And to turn fellows out incompletely trained after 12 months is really not fair to the fellow or the field. So this was a big effort. The ACC HRS EP Advanced Competency Statement was used as part of this effort, which really defines what EP training is, how many procedures you have to do. All the requirements went up. And I just think this is important, that once you finish your training in EP, you need to be competent and well trained, and this was the effort. So please, my intentions were good, or our intentions were good. Many were involved in this effort, and there was uniform support among EP fellowship directors to push for the 2-year program. I also want to make it clear that by having EP now be 3 years of cardiology plus 2 of EP, for the first time we can have a match in electrophysiology, which is something also that program directors and fellows have been clamoring for, because currently fellows will be pressured to accept a position at their institution when perhaps they could get a position at the Mayo Clinic or some other program. And this is a much more fair system that I think will launch in about a year, where it will be just like a standard match. You pick your top 5 options. And I think this is great for fellows. They can match in the best program they can match in. It's great for programs where there's a standard, calendar, in terms of when your preferences have to go in. So I think there's many advantages for this, and I hope it will be appreciated.
Wonderful. Well, thank you so much, Dr. Calkins. That is big news for fellows who are aspiring to go into electrophysiology. And what words of wisdom would you have for fellows who are aspiring to go into EP?
Well, first, let me make a plug for EP. I mean, EP, ever since I've been involved with EP, it's been a fantastic field, and it keeps getting more exciting and a bigger, broader field. If you look at all the new procedures we're doing with appendage occlusion, obviously AF ablation is important, VT ablation, it's a booming area, the new leadless devices, and the job market for those that want a job has never been better. I mean, it's really striking. There's lots of academic positions available, private positions available. 3 years ago, there was a bit of a downturn, but now things have gone crazy, and there's wonderful opportunities. So I would encourage anyone with an interest in EP to pursue your passion. Sign up for a good training program, get trained, and you're going to end up with a great career. I'll make a few other comments just about careers in general, about what when you finish your fellowship, you've had all these great procedures. Now all of a sudden you hang out your shingle, or you're in a group or whatever, and it's time to start seeing patients. And what you'll find is you won't have like a 3-month waiting list the day you first start. You have to be patient. That I think patience, you're just beginning. You have to build your brand. You have to build your referral practice, and you have to do it one patient at a time. And the nice thing is, people always say it's availability, affability, and ability are the 3 things that patients are looking for. And what they want most is available. They want access to their doctor. If they want an appointment, they don't want to wait 6 months. And as someone new out of fellowship, you're going to have a pretty open schedule where you can give really concierge level care to each patient you see, and gradually build your brand. Take time, learn from each patient, read about them, go the extra distance, and before you know it, you'll be like me, where you have a 3-month waiting list, you're completely bogged down with 1 million patients. but you get there one patient at a time, and it seems slow in the beginning, but be patient. The other comment I'll make is don't get into the trap of, because you want to be doing procedures, starting to do procedures when they're not indicated or in the sickest of patients. When you start out, you have to have a good track record. If you have 3 deaths in your first 5 AF ablations, that's a bad start, and it's the word's going to get out, and I won't say your career is going to be ruined, but you better move to another town. So you don't want to pick the highest risk, most complex patients when you first start. It's not the end of the world if one of your senior colleagues either assists with the procedure, does the procedure, so go slow. And the third comment I'll make is the RVU trap. Now the world is a world of RVUs, or many institutions are a world of RVUs where the meter's running and you're collecting RVUs. And I think too many, both people beginning their career and also at any stage in their career start chasing RVUs where they're just, every little RVU is an extra $10, an extra $10 becomes like cocaine or something like that. And you got to realize, you got to take a step back and say, you got to practice high-level care. It's not about the RVUs. Don't buy 5 new cars, join 10 country clubs, and marry someone that needs a lot of funds to keep them happy. Just be careful of that track. Be patient. It will all come. And happiness is not defined by money, but it's by contributing with things like this FIT program. I mean, the ACC is a great example. Get involved, do other things, do research. There's lots of opportunity, and be patient.
Thank you so much, Dr. Calkins, for those words of wisdom. The 3 A's of success. I'm sure our fellows will take a lot away from this interview. For more videos like this, please log on to youtube.com/fitsonthego.